Hello, everyone. My name is Diana Tran, and I'll be talking about combating obesity in a community. So the problem is a community in Birmingham, Alabama has a high rate of obesity, especially in a high school class. They have requested the assistance of nurses to provide health education and promotion to prevent this obesity rate from increasing. Obesity is a growing concern and problem not only in this community, but also all over the world and the United States. As stated by Zurikat and Dugan, obesity is a worldwide epidemic, and the fight against obesity requires changes in many areas of life. Global trends point to increasing prevalence in 97 countries, and approximately 65% of the world's population live in countries where obesity kills more people than underweight. So the learning needs assessment. The priority needs for promoting health in the community is community health attitudes and beliefs, consumption patterns or nutrition, what they eat, leisure pursuits, what they do for exercise, and accessibility of promotive and preventive care. The methods that will be used to assess their learning needs is focus groups, observations, and structured interviews. The objective is to evaluate parent and school staff perspectives of childhood health and weight qualitatively to guide the development of a school-based obesity prevention program. So the health promotion model that we'll be using is the PRECEDE and PRECEDE model, and also incorporating Michelle Obama's national plan, Let's Move. So for the PRECEDE model, phase one is that the community wants to prevent obesity and needs nurses to provide health promotion and health education to the high school class. Phase two are the health problems that will be prevented, such as heart disease, type 2 diabetes, asthma, low self-esteem, depression, hypertension, cancer, and metabolic syndrome. Phase three, behavioral and environmental diagnosis. So behaviors are activity, sedentary lifestyle, food choices, so their lack of healthy food options, the environment, see if there's any access to safe playgrounds, family influence, cultural influence, access to healthy foods, media influence, and phase four will be educational. So we would provide nutrition, education, provide parents and child with education on what is healthy, assess parent self-efficacy, parents' value on physical activity and healthy choices, parents' perception of their child's weight. And then in phase five would be the administrative policies. So school lunch, exercise policies, price and cost of the foods, and advertisements. So why this model? Well, it's a logical model for critical analysis and procedural structure for developing interventions. It is participatory for community involvement, and it's also multi-level evaluation for monitoring and adjusting. So the Michelle Obama's national plan, Let's Move, she had 5 principles. The first one was creating a healthy start for children. So this included strengthening prenatal care, promoting breastfeeding, evaluating impact of chemical influences in the environment, screen time, such as TV and video games, early care and education, such as childhood care centers. She believed that the childhood care centers where parents would drop off their kids were very influential, so we should really tackle them to educate the children while they're there. As far as chemical influences in the environment, believe she wanted to see if we could get rid of some problems in the environment that could potentially influence people to eat unhealthy foods, and it could also be a factor in people's health. So the second one was empowering parents and caregivers, making nutrition information useful. She had a Spot the Block campaign, which HHS has launched this program to encourage children and caregivers to read the nutrition facts label panels. They have recently launched a education campaign based on Spot the Block that targets African American and Hispanic communities. Food marketing. They have done displays of calories on menus at restaurants and healthcare services, providing healthy food in schools. So recently, there's a Healthier U.S. Schools Challenge that establishes rigorous criteria for schools' food quality, participation in meal programs, physical activity, physical education, and nutrition education, which are the key components that make for healthy and active kids, and provides recognition for schools that meet these criteria. So they just go on a website and schools can compete, and it's a really great incentive for schools to have better food or healthier food, and also involve children in physical activity. Number 4 was improving access to healthy, affordable foods, such as food pricing, product formulation, physical access to healthy food. Number 5 is increasing physical activity, expanded day and after school activities, and community recreation venues. So the Health Promotion Health Education Plan, the goal is to decrease the obesity prevalence rate by at least 5%. Educational tools, I thought that it would be really great to have magnets for the refrigerator to give to parents to educate on the food pyramid. It's easy to see on their refrigerator. They would see if they were cooking. Simple applications on phones that can track calories and what children eat for the parents. More educational methods and tools would be incorporating a walking program, organizing farm-to-school programs, encouraging children to walk and bike to school programs, grocery tours to parents, and cooking and food recipe classes for the parents. The 3 behavioral objectives would be that the first one, parents will state understanding of healthy child weight. 2, parents will verbalize understanding of the food pyramid. And 3, children will report physical activity at least 4 to 5 times a week. Some research evidence-based practices that I found was, number 1, there was a study that was done evaluating a walking program that was implemented in Western Pennsylvania. The sample size was 5,158 school-age children. Data was collected over 6 years, and the result was the walking program was beneficial in reducing students' prevalence of obesity and overweight. And in the second evidence-based practice one was, there was a study that was done to evaluate parent and school staff perspectives of childhood health and weight. The sample size consisted of Hispanic parents. 9 of the first graders participated in one of the 3 focus groups, consisting of 3 parents each. School staff, there were 7 in one focus group. They were asked structured interview questions, and the results was that the parents and the school staff had conflicting views over whose responsibility it is to provide nutrition, education, and participating in physical activity. That study was very interesting. The parents felt that the school should teach children about healthy nutrition and guidance in cafeteria and structured physical activity, and the school staff believe that parents have the primary responsibility of ensuring children to get adequate nutrition and physical activity. So they had clashing views. And I think that's something that should definitely be targeted when developing interventions. So another evidence-based practice article that I found was there was research that was done in the communities of color where they implemented programs to create a healthy environment to combat childhood obesity in New Mexico. So the community-based programs implementing environmental and policy interventions to stimulate healthier behavior can reduce health-related risk factors and disease prevalence. In this article, it was really cool. They built an urban community garden, which everyone shared. And also they came up with parent leader trainings and youth leader apprenticeship programs. And their community outreach program included knocking door to door, workshops, and social media to educate residents in cultural farming, gardening, and healthy eating. So evaluation of the health promotion and health education plan, it would be evaluated based on the prevalence rate of obesity in the community, if it's decreased or increased. The BMI data collected after a walking program is implemented. Survey data on perspectives of school staff and parents on implementation of programs and the education that was provided. Reassessment of parental knowledge in nutrition and healthy child weight, and also to track the physical activity rates, if it's increased or decreased. And as a conclusion, I think to move forward, there should be technology such as iPhones that can be utilized as a game to track physical activity and provide incentives to become more active. Schools and parents should collaborate to increase consistency between children in how they view healthy eating and nutrition. Building an urban farm on a city-owned land for the community is a great idea to provide access to healthy food. Utilizing social media to advertise quick recipes and healthy choices is great for sharing within the community. And schools should include education on nutrition on a daily basis, not just once in a while. And that concludes my presentation. Thank you so much for watching.